Hello, I'm Dr. Avinash Verma. I'm cardiac electrophysiologist and I work in BL Kapoor Max Hospital in New Delhi. So today we were doing one case called electrophysiological study and radiofrequency ablation. So it is a branch of cardiology which deals with the electrical problems of the heart. Some patients have very fast heart rates and irregular heart rates. These patients can have palpitation, feeling of breathlessness, lightheadedness, sometimes even fainting, and they feel that their heart rate is going very fast. If this is the situation, then they need to consult the cardiologist or a dedicated electrophysiologist. Sometimes what happens, these patients are born with extra connections between the upper and lower chambers of the heart, which leads to short circuit between the normal connection and extra connection, which leads to very fast heart rate up to 200, 220, up to 240 beats per minute. If your heart rate is going so fast, then it needs to be investigated. Most of the times, the cause for these things is called paroxysmal supraventricular tachycardia, or PSVT is the name of the disease. It simply means that there is an extra connection and because of the short circuit, heart rate is going fast. What we need to do is do an electrophysiological study, in this case, which is study of electrical properties of heart, in which we can find out all the electrical connections of the heart, which is causing a problem. And once we find out, we do radiofrequency ablation, or RFA. What RFA does is it finds the source of these arrhythmias and it gives the radiofrequency energy to those source to finish the arrhythmias. EPS RFA is a very well-known, established and very effective procedure. The success rate for PSVT for EPS RFA is close to 99%, and it's a cure rate. That means that the problem is cured forever, throughout the life. Patient need not to take any more medicines or anything after doing the procedure. Beyond that, there are other arrhythmias for which more complex procedures such as 3D EPS RFA is required, 3-dimensional EPS RFA. Those arrhythmias could be atrial fibrillation, atrial flutter, ventricular tachycardia. These arrhythmias are more complex arrhythmias and usually happen in those patients who have some other diseases of the heart, particularly blockages or damaged heart with reduced ejection fraction or heart rate pumping gone low. These patients can have these life-threatening arrhythmias which are taken care by other more complex procedures such as 3D RFA or implanting devices such as ICDs. And if such is the situation with your heart, then you should consult your doctor, as these are life-saving procedures. Thank you.